Question 1. A nurse is caring for a client with heart failure who is prescribed furosemide, Lasix. Which electrolyte imbalance should the nurse monitor most closely? A. Hyperkalemia. B. Hypokalemia. C. Hypernatremia. D. Hyponatremia. Answer B. Hypokalemia. This question tests understanding of common side effects of loop diuretics like furosemide. The keyword furosemide indicates a medication that removes fluid, and it also causes potassium loss. Hypokalemia, meaning low potassium levels, is a frequent and potentially serious adverse effect that can lead to cardiac issues like arrhythmias. Monitoring potassium levels is crucial for patient safety. For example, a normal potassium level is around 3.5-5 milliequivalent/L, and a level below this requires intervention. A good takeaway is, diuretics often make you lose K+. Question 2. Which assessment finding is the highest priority for a client experiencing an acute asthma attack? A. Wheezing heard on expiration. B. Respiratory rate of 28 breaths/min. C. Use of accessory muscles for breathing. D. Reduced breath sounds in the upper lobes. Answer D. Reduced breath sounds in the upper lobes. The core concept here is prioritizing interventions during an acute respiratory event, focusing on potential life threats. Reduced breath sounds, especially if they become absent, can indicate a severe bronchospasm or a potentially life-threatening condition called a silent chest, meaning air is not moving effectively. While wheezing, increased respiratory rate, and accessory muscle use, options A, B, C, are important signs of distress. Absent or significantly diminished breath sounds suggest a more critical impairment of airflow. Imagine listening to the lungs like listening for traffic. Quiet lungs mean the traffic, air, isn't getting through, which is the most urgent problem. Always listen for the absence of sound as a critical sign. Question 3. A client is prescribed digoxin, Lanoxin. Which statement indicates the client understands how to take this medication safely? A. I should take this medication with grapefruit juice to help it absorb better. B. I will check my pulse rate before taking the dose each morning. C. If I miss a dose, I can take 2 doses the next day to catch up. D. I can stop taking this medication if I feel better. Answer B. I will check my pulse rate before taking the dose each morning. This question assesses understanding of safe medication administration for digoxin, a cardiac glycoside. The critical point is knowing that digoxin affects heart rate, and a key safety measure is assessing the pulse before administration to prevent toxicity, specifically bradycardia, slow heart rate. Checking the pulse helps ensure the heart rate is within the safe range specified by the provider before taking the medication. Taking 2 doses if one is missed or stopping the medication abruptly can be dangerous. Grapefruit juice can interact with many medications, though not typically digoxin in a clinically significant way compared to pulse checking. Remember to always check your pulse before taking heart medications like digoxin. Question 4. A nurse is performing discharge teaching for a client who had a total hip arthroplasty. What is a crucial instruction regarding positioning? A. Sleep with pillows between the legs. B. Cross the legs when sitting. C. Bend the affected hip past 90 degrees. D. Rotate the affected leg inward. Answer A. Sleep with pillows between the legs. The question focuses on postoperative care after a total hip replacement, specifically preventing dislocation. The keyword total hip arthroplasty highlights the need to maintain proper alignment and avoid movements that could dislodge the new joint. Sleeping with pillows between the legs helps maintain abduction, keeping the femoral head securely within the acetabulum, hip socket, and preventing internal rotation or adduction, which can cause dislocation. Crossing legs, bending past 90 degrees, and inward rotation are movements that increase the risk of dislocation. Think of the pillow as a gentle reminder to keep the hips aligned. Question 5. A client has a new prescription for warfarin, Coumadin. The nurse should reinforce teaching about the importance of A. Maintaining a consistent intake of vitamin K-rich foods. B. Taking aspirin 81 mg daily for anticoagulation. C. Avoiding all green leafy vegetables. D. Increasing intake of high-fat foods. Answer: A. Maintaining a consistent intake of vitamin K-rich foods. This question relates to anticoagulation therapy and dietary interactions, specifically with warfarin. Vitamin K is the antidote to warfarin, so large fluctuations in vitamin K intake can significantly alter the drug's effectiveness, measured by the INR, International Normalized Ratio. Maintaining a consistent, moderate intake of vitamin K-rich foods, rather than avoiding them completely or consuming excessive amounts, is key to stable anticoagulation. Aspirin is generally avoided with warfarin due to increased bleeding risk. High-fat foods aren't the primary dietary concern. Remember, consistency is key with vitamin K intake while on warfarin. Question 6. A client is admitted with symptoms of a myocardial infarction, MI. Which laboratory test result would the nurse expect to be elevated? A. Hemoglobin A1C. B. Troponin I. C. White blood cell count. D. Blood urea nitrogen, BUN. Answer: B. Troponin I. This question tests knowledge of cardiac biomarkers used to diagnose myocardial infarction, heart attack. Troponin I and troponin T are proteins released into the bloodstream when heart muscle is damaged. Elevated levels specifically indicate cardiac muscle injury, making it the most definitive indicator among the choices for an acute MI. Hemoglobin A1C reflects long-term glucose control, WBC count can indicate infection or inflammation, and BUN relates to kidney function or hydration status. Think of troponin as the specific smoke detector for heart muscle damage. Question 7. What is the priority nursing intervention for a client experiencing sudden shortness of breath and wheezing? A. Administer prescribed oral antihistamine. B. Encourage pursed lip breathing. C. Administer prescribed short-acting bronchodilator. D. Elevate the head of the bed. Answer: C. Administer prescribed short-acting bronchodilator. The concept tested is prioritizing respiratory interventions in an acute distress situation. Sudden shortness of breath and wheezing suggest bronchoconstriction, meaning the airways are narrowing. The priority is to open the airways quickly. A short-acting bronchodilator, such as albuterol, directly addresses bronchoconstriction by relaxing the smooth muscles of the airways, providing rapid relief. Elevating the head of the bed helps ease breathing, and pursed lip breathing can be helpful but are secondary to immediate pharmacological intervention. Antihistamines are not indicated for acute bronchospasm. Remember, when airways are tight, the first step is to open them with medication. Question 8. A nurse is caring for a post-operative client following a cataract extraction. Which instruction is essential for preventing complications? A. Use eye patches continuously for the first week. B. Avoid rubbing or applying pressure to the affected eye. C. Resume normal activities including lifting heavy objects immediately. D. Instill steroid eye drops only when vision becomes blurry. Answer B. Avoid rubbing or applying pressure to the affected eye. This question addresses post-operative care after eye surgery, specifically cataract extraction. The key concern is protecting the surgical site from increased intraocular pressure or physical disruption, which could lead to complications like infection or lens displacement. Rubbing or applying pressure to the eye increases this risk significantly. Eye patches are often used temporarily, heavy lifting is typically restricted, and steroid drops are usually prescribed on a specific schedule, not just when symptoms arise. Protecting the eye is paramount after this surgery. Think of the eye like a delicate repair job, don't bump or press on it. Question 9. A client with a history of hypertension is prescribed lisinopril, Zestril. What common side effect should the nurse monitor for? A. Dry cough. B. Constipation. C. Drowsiness. D. Weight gain. Answer A. Dry cough. The question relates to pharmacologic management of hypertension and potential side effects of ACE inhibitors, like lisinopril. A characteristic side effect of ACE inhibitors is a persistent, dry, tickling cough, believed to be caused by the accumulation of bradykinin in the respiratory tract. While other side effects can occur with antihypertensives, the cough is notably common with this specific drug class. Constipation, drowsiness, and weight gain are less commonly associated with lisinopril compared to the cough. Here's a helpful reminder. ACE inhibitors can sometimes make you cough. Question 10. A nurse is assessing a client with suspected appendicitis. Which assessment finding requires the nurse's immediate attention? A. Pain initially felt around the umbilicus. B. Nausea and vomiting. C. Rebound tenderness at McBurney's point. D. Abdominal rigidity and fever. Answer D. Abdominal rigidity and fever. This question focuses on identifying critical signs associated with appendicitis, a common surgical emergency. While initial periumbilical pain, nausea/vomiting, and rebound tenderness are classic signs, abdominal rigidity, a board-like abdomen, and fever suggest potential complications like perforation or peritonitis, which are medical emergencies requiring immediate intervention. Peritonitis is inflammation of the abdominal lining, often caused by a ruptured organ, and is life-threatening. Think of rigidity and fever as warning bells signaling a serious worsening situation. Question 11. A client is receiving radiation therapy for breast cancer. Which nursing intervention is most important for managing skin reactions? A. Apply alcohol-based lotions to the affected area. B. Use a soft cloth or sponge to wash the area gently. C. Expose the irradiated area to direct sunlight. D. Remove any prescribed markings promptly. Answer B. Use a soft cloth or sponge to wash the area gently. This question concerns managing side effects of radiation therapy, specifically skin reactions, radiodermatitis. The skin in the radiation field becomes very sensitive, similar to a sunburn. Gentle cleansing with a soft cloth and mild, non-irritating soap is crucial to prevent further irritation or damage. Alcohol-based products, sunlight exposure, and removing markings can worsen the reaction. Protecting the sensitive skin is the goal. A good tip: treat the radiated skin gently, like you would a bad sunburn. Question 12. A client with chronic kidney disease, CKD, has a potassium level of 6.2 milliequivalent/L. Which intervention should the nurse prepare to implement? A. Administer potassium-sparing diuretics. B. Encourage increased intake of potassium-rich foods. C. Prepare for administration of sodium polystyrene sulfonate, K-exhalate. D. Administer intravenous normal saline infusion. Answer C. Prepare for administration of sodium polystyrene sulfonate, K-exhalate. The question tests knowledge of managing hyperkalemia, high potassium level, a common complication in CKD. A potassium level of 6.2 milliequivalent/L is significantly elevated and requires intervention to lower it, as it can cause life-threatening cardiac arrhythmias. Sodium polystyrene sulfonate, K-exhalate, is an ion exchange resin that exchanges sodium for potassium in the intestines, promoting potassium excretion. Potassium-sparing diuretics increase potassium levels, high potassium foods worsen hyperkalemia, and normal saline doesn't directly lower potassium. Think of K-exhalate as a way to clean out the excess potassium from the body. Question 13. A nurse is teaching a client newly diagnosed with type 1 diabetes mellitus about blood glucose monitoring. Which instruction is most important? A. Check your blood glucose level only when you feel symptoms of high or low sugar. B. Always wash your hands thoroughly before checking your blood glucose. C. Use the same finger each time to ensure consistency. D. Record the reading, but don't worry about the time of day. Answer B. Always wash your hands thoroughly before checking your blood glucose. This question assesses essential practices for accurate self-monitoring of blood glucose, SMBG, crucial for diabetes management. The most critical step for accuracy is preventing contamination of the sample. Washing hands thoroughly before pricking the finger removes potential contaminants, like sugar or food residue, that could falsely elevate the glucose reading. Checking only when symptomatic misses important trends. Using the same finger can cause irritation, and time of day is vital for interpreting results. Accuracy starts with clean hands. Remember, clean hands lead to reliable blood sugar numbers. Question 14. Which finding requires immediate nursing intervention in a client recovering from abdominal surgery? A. Serous drainage on the dressing. B. Distension of the abdomen with tympany on percussion. C. Mild incisional pain controlled with analgesics. D. Passing flatus. Answer B. Distension of the abdomen with tympany on percussion. The question focuses on identifying potential postoperative complications after abdominal surgery. Abdominal distension, swelling, and tympany, a drum-like sound when tapping the abdomen, can indicate the buildup of gas or, more concerningly, a paralytic ileus, where the bowel stops functioning normally. This can lead to bowel obstruction, a serious condition requiring prompt intervention. Serous drainage can be normal, passing flatus indicates returning bowel function, and controlled pain is expected. A distended, tense abdomen is a red flag for decreased bowel motility. Think of a tight, swollen balloon, it signals something isn't right inside. Question 15. A client is prescribed atorvastatin, Lipitor, for hyperlipidemia. What essential teaching should the nurse provide regarding a potentially serious adverse effect? A. Report any new onset of cloudy urine immediately. B. Take the medication consistently every morning before breakfast. C. Avoid consuming grapefruit juice while taking this medication. D. Report any unusual muscle aches or weakness promptly. Answer D. Report any unusual muscle aches or weakness promptly. This question addresses the critical safety information for statin medications like atorvastatin, used to lower cholesterol. A serious potential side effect is rhabdomyolysis, a condition involving severe muscle damage, which can lead to kidney failure. Muscle pain, tenderness, or weakness are key early indicators that must be reported to the healthcare provider for evaluation. Cloudy urine, A. might suggest kidney issues but isn't the primary direct warning sign for statins. While medication timing, B, and food interactions, C, are relevant for some drugs, muscle symptoms are the most crucial safety point for statins. For example, feeling unusually sore after light activity could be a warning sign. Always inform your provider about unexplained muscle pain when taking statins. Question 16. A nurse is assessing a client with a possible stroke, cerebrovascular accident. Which finding is most indicative of a right-sided cerebral hemisphere stroke? A. Aphasia, difficulty speaking. B. Left-sided facial droop. C. Left arm weakness, hemiparesis. D. Neglect of the left side of the body. Answer, D. Neglect of the left side of the body. This question addresses neurological deficits associated with stroke localization. Strokes affecting the right hemisphere often result in deficits on the left side of the body, including hemiparesis, weakness, and sensory loss, but also characteristic spatial perceptual deficits like neglect, where the client is unaware of or ignores the left side. Left-sided facial droop and left arm weakness are also signs of right-sided stroke, but neglect is particularly characteristic of right hemisphere involvement. Aphasia, difficulty with language, is typically associated with left hemisphere strokes. Remember that right brain issues often cause left-sided problems, including ignoring the left. Question 17. What is the primary purpose of administering stool softeners to a postoperative client? A. To treat diarrhea. B. To prevent constipation and straining. C. To increase appetite. D. To relieve abdominal gas pain. Answer, B. To prevent constipation and straining. This question relates to common postoperative care aimed at promoting comfort and preventing complications. Following surgery, especially abdominal surgery, clients often experience decreased bowel motility due to anesthesia, pain medications, opioids, and reduced activity. Stool softeners help prevent constipation by adding moisture to the stool, making it easier to pass and reducing the need for straining, which could otherwise compromise a surgical incision. They do not treat diarrhea, increase appetite, or directly relieve gas pain, though preventing straining indirectly aids comfort. Think of stool softeners as making bowel movements easier after surgery. Question 18. A nurse is preparing to administer an intramuscular, IM, injection. Which angle should the nurse use for a typical adult client? A. 45 degrees. B. 60 degrees. C. 75 degrees. D. 90 degrees. Answer, D. 90 degrees. This question pertains to basic principles of medication administration technique. An intramuscular injection is given directly into the muscle tissue. For most adults with adequate muscle mass, a 90-degree angle allows the needle to reach the muscle belly effectively and safely. Deltoid, ventrogluteal, and vastus lateralis muscles are common sites. Angles like 45 or 60 degrees are typically used for subcutaneous injections or for IM injections in very thin or emaciated clients to avoid hitting the bone. Remember, IM goes straight in 90 degrees to hit the muscle. Question 19. A client with Addison's disease is learning to manage their hydrocortisone replacement therapy. What crucial instruction should the nurse provide regarding illness or stress? A. Take the entire daily dose upon waking each morning. B. Increase the hydrocortisone dosage as instructed during periods of stress or illness. C. Stop taking the medication temporarily if experiencing nausea. D. Take the medication with calcium supplements to aid absorption. Answer B. Increase the hydrocortisone dosage as instructed during periods of stress or illness. This question tests understanding of managing adrenal insufficiency, Addison's disease, with hormone replacement. Addisonian crises, which are life-threatening, can be precipitated by physiological stress such as infection or surgery. Patients must be taught to increase their hydrocortisone dose during these times, following specific guidance from their healthcare provider to meet the body's heightened need for cortisol. Taking the entire dose in the morning, might be part of a regimen, but stress dosing is vital for crisis prevention. Stopping abruptly, C, or taking with calcium, D, are incorrect and potentially harmful advice. Think of stress dosing as providing extra fuel when the body is under strain. Always have a plan for increasing your dose when sick or stressed. Question 20. A client with type 1 diabetes mellitus uses insulin injections. What is the most important instruction regarding injection site selection? A. Use the same site each day to ensure consistent absorption. B. Rotate injection sites within the same anatomical area. C. Inject insulin only into fatty areas like the abdomen. D. Massage the site vigorously after injection to improve absorption. Answer B. Rotate injection sites within the same anatomical area. This question focuses on safe insulin administration techniques to ensure predictable absorption and prevent complications. Rotating injection sites within the same general area, e.g., moving around the abdomen or thighs, helps prevent lipohypertrophy, which is the thickening or hardening of subcutaneous fat tissue caused by repeated injections in the same spot. Lipohypertrophy can significantly impair insulin absorption, leading to erratic blood glucose control. Using the same site daily, A, causes lipohypertrophy. Injecting only in fatty areas is too narrow, muscles can be used if appropriate, and vigorous massage, D, is generally not recommended as it can speed absorption unpredictably. Consistent rotation ensures better medication uptake. Remember to vary your injection spots to keep absorption steady. Question 21. A patient develops atrial fibrillation with a rapid ventricular response, RVR. Which medication class is commonly used to control the heart rate? A. Beta blockers. B. Diuretics. C. Antibiotics. D. Proton pump inhibitors. Answer A. Beta blockers. This question assesses understanding of medications used to manage atrial fibrillation with RVR. Beta blockers, like metoprolol, work by slowing the heart rate and reducing the conduction velocity through the AV node, which helps control the rapid ventricular response common in this arrhythmia. Diuretics are used for fluid overload, antibiotics for infections, and PPIs for acid reflux. None are primary treatments for controlling heart rate in AFib RVR. Think of beta blockers as putting the brakes on a fast-running heart. Question 22. What is the primary rationale for elevating the foot of the bed and lowering the head of the bed for a client receiving continuous enteral tube feedings? A. To prevent aspiration. B. To increase nutrient absorption. C. To promote gastric emptying. D. To reduce abdominal discomfort. Answer A. To prevent aspiration. The question concerns safe administration of enteral tube feedings. Elevating the head of the bed, semifowlers or higher, helps keep the stomach contents down and reduces the risk of refluxing into the esophagus and potentially being aspirated, inhaled into the lungs. Maintaining this position during and for a period after feeding is a critical safety measure. While it might aid emptying or reduce discomfort, the primary goal is aspiration prevention. Aspiration can lead to serious pneumonia. Keep the head elevated during tube feeds to keep the formula where it belongs. Question 23. A nurse is caring for a client with Guillain-Barré syndrome. Which finding requires the most immediate nursing assessment? A. Decreased sensation in the feet. B. Muscle weakness progressing upward. C. Difficulty swallowing. D. Changes in urine output. Answer: C. Difficulty swallowing. This question pertains to the potential complications of Guillain-Barré syndrome, an autoimmune disorder affecting peripheral nerves. The ascending paralysis can affect respiratory muscles and cranial nerves controlling swallowing and breathing. Difficulty swallowing, dysphagia, indicates potential involvement of cranial nerves and places the client at high risk for aspiration and respiratory compromise, making it the most immediate concern requiring assessment. While upwardly progressing weakness is characteristic, dysphagia signals a direct threat to airway safety. Think of swallowing difficulty as a sign that breathing might be next to be affected. Question 24. A client is receiving vancomycin for a severe infection. What is the most important nursing intervention during administration? A. Administer the infusion rapidly over 15 minutes. B. Monitor the client for red man syndrome. C. Encourage increased fluid intake to prevent kidney damage. D. Assess for therapeutic drug levels via peak and trough testing. Answer: B. Monitor the client for red man syndrome. This question focuses on safe administration of vancomycin, an antibiotic. A key adverse effect, particularly when infused too quickly, is red man syndrome, characterized by flushing, erythema, and sometimes itching, primarily on the face and neck. It's important to infuse vancomycin slowly, typically over 60 minutes or more, to minimize this reaction. While monitoring peak and trough levels, D, is essential for efficacy and preventing toxicity, like kidney damage, and fluids, C, are generally good practice. Recognizing and preventing red man syndrome during infusion is the most immediate administration-related concern. Remember to watch for a red flush during vancomycin infusion. Question 25. A client with diabetes asks the nurse about exercising. What is the best advice? A. Exercise vigorously right after eating a meal. B. Exercise only when blood glucose is above 250 mg per deciliter. C. Check blood glucose before and after exercise, and carry a carb source. D. Avoid exercise if insulin is taken. Answer: C. Check blood glucose before and after exercise, and carry a carb source. This question addresses safe exercise practices for clients with diabetes. Exercise can lower blood glucose levels, potentially leading to hypoglycemia, low blood sugar. Checking glucose before and after exercise helps gauge the effect, and carrying a source of fast-acting carbohydrates, like glucose tablets or juice, allows for prompt treatment if hypoglycemia occurs. Exercising immediately after eating can cause rapid glucose spikes. Exercising with very high blood sugar can worsen hyperglycemia, and avoiding exercise is generally not recommended. Remember to check your sugar and carry a snack before exercising with diabetes. Question 26. A nurse is assessing a client with pneumonia. Which finding suggests the client is experiencing impaired gas exchange? A. Respiratory rate of 18 breaths/min. B. Oxygen saturation of 95% on room air. C. Client reports feeling short of breath and confused. D. Clear bilateral lung sounds. Answer: C. Client reports feeling short of breath and confused. The core concept is recognizing signs of impaired gas exchange, where the body isn't getting enough oxygen or eliminating enough carbon dioxide. Shortness of breath is a direct symptom, and confusion can indicate that the brain isn't receiving adequate oxygen. While a respiratory rate of 18 is normal, 95% oxygen saturation is generally acceptable, and clear lung sounds are positive findings. The client's subjective feeling of breathlessness combined with altered mental status strongly suggests a problem with oxygenation. Think of confusion as a brain signal that it's not getting enough air. Question 27. A nurse is assessing a client with symptoms of fluid volume overload. Which clinical finding requires the most immediate nursing intervention? A. Mild ankle edema. B. Weight gain of 1 pound over 24 hours. C. Crackles heard at the bases of the lungs. D. Decreased urine-specific gravity. Answer, C. Crackles heard at the bases of the lungs. This question tests the recognition of severe fluid volume overload, which can lead to pulmonary congestion. Crackles, abnormal lung sounds often described as bubbling or rattling, at the lung bases indicate that fluid is accumulating in the alveoli, impairing gas exchange and potentially leading to respiratory distress. This finding signifies that the fluid overload is affecting the lungs and requires immediate intervention, such as administering a diuretic and potentially elevating the head of the bed. Mild edema, A, and a 1 pound weight gain, B, are signs of fluid retention but are less acute. Decreased urine-specific gravity, D, usually indicates excess fluid dilution or poor concentrating ability, but crackles point directly to respiratory compromise. Think of crackles as fluid getting into the lungs, making breathing difficult. Question 28. A nurse is reviewing discharge instructions for a client with heart failure. Which instruction is most important to prevent exacerbations? A. Restrict fluid intake to 1 liter per day. B. Weigh yourself daily and report significant weight gain. C. Eat a diet low in carbohydrates. D. Increase sodium intake to maintain fluid balance. Answer, B. Weigh yourself daily and report significant weight gain. The question focuses on self-management strategies for heart failure, HF. Daily weight monitoring is crucial because rapid weight gain, e.g., 2 to 3 pounds in a day or 5 pounds in a week, is often the earliest indicator of fluid retention, a hallmark of worsening HF. Reporting this promptly allows for medication adjustments, like diuretics, to prevent a full exacerbation. Fluid restriction may be ordered, but daily weights are the most direct way for the client to track fluid status. Low carbs and increased sodium are generally not recommended for HF management. Think of the scale as your daily checkup for heart failure. Question 29. A client has a prescription for a potassium chloride, KCl, infusion. What is the highest priority nursing assessment before administering this medication? A. Assess the client's bowel sounds. B. Check the client's urine output. C. Measure the client's oral temperature. D. Auscultate the client's lung sounds. Answer, B. Check the client's urine output. This question relates to the safe administration of intravenous potassium chloride, KCl. Potassium is primarily excreted by the kidneys, so adequate urine output is essential to prevent dangerous accumulation of potassium in the body, hyperkalemia. Administering KCl to a client with poor urine output could lead to life-threatening hyperkalemia. Therefore, confirming adequate renal function, indicated by sufficient urine output, typically at least 30 to 40 ml/hr, is the highest priority assessment before starting the infusion. Bowel sounds, temperature, and lung sounds are less directly related to potassium excretion safety. Always check that the kidneys are working before giving potassium. Question 30. A client is taking ferrous sulfate, iron supplement, for anemia. What common side effect should the nurse educate the client about? A. Diarrhea. B. Darkening of the stool. C. Increased appetite. D. Decreased urination. Answer B. Darkening of the stool. This question focuses on patient education for a common medication, iron supplements. A frequent and expected side effect of oral iron supplements like ferrous sulfate is the darkening of the stool, often to a black or dark green color. This occurs because unabsorbed iron is excreted. While constipation is more common than diarrhea, and appetite changes aren't typical, the stool color change is almost universal and can sometimes cause undue alarm if the client isn't prepared. It's important to reassure the client that this is normal and not a sign of bleeding. Remember, dark stools are a normal sign you're taking iron. Question 31. A nurse is caring for a client who received a general anesthetic. Which finding requires immediate follow-up? A. Client sleeping soundly. B. Mild nausea. C. Inability to state full name correctly. D. Respiratory rate of 10 breaths/min. Answer D. Respiratory rate of 10 breaths/min. The question relates to post-anesthesia care and recognizing potential complications. A respiratory rate of 10 breaths/min is below the normal range, typically 12 to 20, and may indicate respiratory depression, a serious side effect of general anesthesia and associated medications, like opioids. While sleeping soundly and mild nausea are common, and orientation may be slightly delayed, a significantly depressed respiratory rate requires immediate assessment and intervention to ensure adequate oxygenation. Think of breathing rate as the most vital sign to watch immediately after anesthesia. Question 32. Which instruction should a nurse provide to a client diagnosed with GERD, gastroesophageal reflux disease? A. Lie down immediately after eating. B. Eat large meals before bedtime. C. Avoid trigger foods like caffeine and fatty foods. D. Drink carbonated beverages with meals. Answer C. Avoid trigger foods like caffeine and fatty foods. This question focuses on lifestyle modifications for managing GERD. Certain foods and activities can relax the lower esophageal sphincter or increase stomach acid production, worsening reflux. Common triggers include caffeine, alcohol, fatty or fried foods, chocolate, and peppermint. Lying down after eating, eating large meals before bed, and drinking carbonated beverages can all exacerbate reflux symptoms. Avoiding identified triggers is a cornerstone of GERD management. Remember to pinpoint and avoid your personal reflux triggers. Question 33. A client has a deep vein thrombosis, DVT, and is prescribed warfarin. Which nursing action is most critical? A. Administer the prescribed dose of warfarin. B. Assess the client's international normalized ratio, INR. C. Encourage ambulation to promote circulation. D. Apply warm compresses to the affected leg. Answer B. Assess the client's international normalized ratio, INR. The question centers on monitoring the effectiveness and safety of warfarin therapy for DVT. Warfarin is an anticoagulant, and its therapeutic effect is monitored via the INR. The INR needs to be within a specific range, often 2.0-3.0, to ensure the blood is adequately thin to prevent clot extension but not so thin as to cause excessive bleeding. While administering warfarin, A. is the prescription, monitoring the INR, B. ensures it's working safely. Ambulation, C. might be restricted initially, and warm compresses, D, are not the primary intervention for warfarin monitoring. Think of INR as the gauge for your blood thinner. Question 34. A nurse is preparing to administer naloxone, Narcan, to a client suspected of opioid overdose. What is the expected therapeutic outcome? A. Decreased respiratory rate. B. Increased sedation. C. Reversal of respiratory depression. D. Lowered heart rate. Answer, C. Reversal of respiratory depression. The question asks about the therapeutic effect of naloxone. Naloxone is an opioid antagonist, meaning it blocks the effects of opioids at receptor sites. Its primary purpose in overdose is to rapidly reverse the life-threatening respiratory depression caused by opioids, restoring spontaneous breathing. It does not decrease respiratory rate or increase sedation. In fact, it can cause withdrawal symptoms in opioid-dependent individuals. While heart rate might change, reversing respiratory depression is the critical, life-saving action. Naloxone's main job is to bring breathing back. Question 35. A client with asthma is using an albuterol inhaler. What indicates the medication is effective? A. Increased wheezing. B. Decreased heart rate. C. Relief of shortness of breath. D. Drowsiness. Answer, C. Relief of shortness of breath. This question assesses the understanding of medication effects in asthma management. Albuterol is a short-acting beta agonist, a bronchodilator that relaxes airway smooth muscles. Its effectiveness is demonstrated by an improvement in symptoms, primarily the relief of bronchospasm, leading to decreased shortness of breath and wheezing. Increased wheezing or drowsiness would be adverse effects, and decreased heart rate is not the primary indicator of effectiveness, though increased heart rate can be a side effect. Think of albuterol as opening up your airways so you can breathe easier. Question 36. A nurse is teaching a client about managing heart failure. Which dietary recommendation is most important? A. Reduce sodium intake. B. Increase potassium intake. C. Limit fluid intake strictly to 500 milliliters daily. D. Consume high-protein, low-carbohydrate meals. Answer, A. Reduce sodium intake. The question focuses on dietary management crucial for heart failure, HF. Sodium causes the body to retain water, which increases fluid volume and puts extra strain on the heart in clients with HF. Reducing sodium intake helps manage fluid retention and edema, thereby decreasing the workload on the heart. While potassium intake is important for heart function, sodium restriction is the primary dietary intervention for HF management. Strict fluid limits, C, are sometimes ordered but depend on severity, and diet composition, D, is secondary to sodium control. Remember, less salt helps your heart hold less fluid. Question 37. A client is prescribed levothyroxine, Synthroid E, for hypothyroidism. What critical instruction should the nurse provide? A. Take this medication at bedtime. B. You can stop taking it once you feel energetic. C. Take it on an empty stomach, preferably in the morning. D. Increase your intake of calcium-rich foods. Answer, C. Take it on an empty stomach, preferably in the morning. The question pertains to the proper administration of levothyroxine, a synthetic thyroid hormone. To ensure optimal absorption and consistent blood levels, levothyroxine should be taken on an empty stomach, typically in the morning, at least 30 to 60 minutes before breakfast or other medications. Taking it at bedtime, A, can interfere with sleep and absorption, stopping it abruptly, B, will cause symptoms to return, and while calcium can interfere with absorption, making D potentially incorrect advice, the timing and empty stomach instruction is most crucial for efficacy. Consistent daily dosing is key for thyroid replacement. Think of taking your thyroid pill first thing before anything else occupies your stomach. Question 38. A client reports symptoms of a urinary tract infection, UTI, including dysuria and frequency. What is the priority nursing assessment? A. Assess vital signs. B. Obtain a urine sample for culture and sensitivity. C. Administer an antispasmodic medication. D. Encourage increased fluid intake. Answer B. Obtain a urine sample for culture and sensitivity. This question addresses the initial management of a suspected UTI. Before initiating treatment, it's essential to obtain a urine sample for a urinalysis and culture and sensitivity (C&S) testing. This confirms the presence of infection, identifies the specific bacteria causing it, and determines which antibiotics will be most effective. While assessing vital signs, A, is standard, and encouraging fluids, D, and administering medication, C, are important parts of treatment, obtaining the urine specimen before treatment is the priority for accurate diagnosis and effective therapy. You need to know what you're fighting before you prescribe the weapon. Question 39. A nurse is assessing a client post-cholecystectomy, gallbladder removal. What finding might indicate a potential complication? A. Pain controlled with prescribed analgesics. B. Bile stain drainage from the surgical site. C. Client ambulating in the hallway. D. Temperature of 101.5 degree F, 38.6 degree C. Answer D. Temperature of 101.5 degree F, 38.6 degree C. The question focuses on recognizing potential postoperative complications after cholecystectomy. A fever of 101.5 degree F, 38.6 degree C, is concerning, especially occurring after surgery, as it could signify an infection, such as a wound infection, cholangitis, bile duct infection, or pneumonia. While some mild elevation might occur, this temperature warrants further investigation. Controlled pain, bile drainage, if a drain is present, and ambulation are generally expected or acceptable findings. Think of fever as a red flag for infection after surgery. Question 40. A client is prescribed clopidogrel, Plavix. What important side effect should the nurse monitor for? A. Bradycardia. B. Bleeding. C. Bronchospasm. D. Hyperglycemia. Answer B. Bleeding. This question relates to antiplatelet medications. Clopidogrel is an antiplatelet drug commonly used to prevent blood clots, particularly after procedures like stent placement or in clients with cardiovascular disease. Its mechanism involves inhibiting platelet aggregation, which, while beneficial for preventing clots, also increases the risk of bleeding. Therefore, monitoring for signs of bleeding, e.g., bruising, nosebleeds, blood in stool or urine, is essential. Bradycardia relates to heart rate meds, bronchospasm to respiratory meds, and hyperglycemia to diabetes management. Remember, drugs that stop clots can also cause bleeding. Question 41. A nurse is caring for a client receiving packed red blood cells, PRBCs. What is the priority nursing action before starting the transfusion? A. Administer a dose of acetaminophen. B. Check the client's temperature and vital signs. C. Ensure the client has received an antihistamine. D. Prime the blood tubing with dextrose 5% in water. Answer B. Check the client's temperature and vital signs. The question concerns the critical safety steps before initiating a blood transfusion. Baseline vital signs, especially temperature, pulse, respiration rate, and blood pressure, must be obtained immediately before starting the transfusion. This baseline allows the nurse to detect any adverse reaction, like fever, chills, or changes in blood pressure, that occurs during the transfusion by comparing it to the pre-transfusion assessment. Acetaminophen isn't routinely given beforehand. Antihistamines aren't standard pre-medication unless specifically ordered for known allergy, and blood is primed with normal saline, not dextrose, to prevent cell lysis. Always get your baseline vitals before starting blood. Question 42. A client with chronic obstructive pulmonary disease, COD, has difficulty clearing secretions. What intervention is most effective? A. Administering cough suppressants. B. Encouraging vigorous coughing exercises hourly. C. Providing humidified oxygen. D. Teaching diaphragmatic and pursed lip breathing techniques. Answer: D. Teaching diaphragmatic and pursed lip breathing techniques. This question addresses respiratory management for COPD clients struggling with secretions. While humidification, C, can help thin secretions, and controlled coughing is needed, diaphragmatic breathing helps utilize the lungs more efficiently, and pursed lip breathing helps prevent airway collapse during exhalation, facilitating the clearance of trapped air and mucus. Cough suppressants, A, would hinder secretion removal. Vigorous coughing, B, can be exhausting and potentially lead to bronchospasm. Controlled, effective techniques are preferred. Pursed lip breathing is particularly key for COPD patients to maintain airway pressure. Remember, breathing techniques help control airflow to clear mucus effectively. Question 43. A nurse is assessing a client with a new cast on their left leg. Which finding requires immediate notification of the healthcare provider? A. Pedal pulse is strong and present. B. Toes are pink and warm. C. Client reports numbness and tingling in the toes. D. Capillary refill in the toes is less than 3 seconds. Answer: C. Client reports numbness and tingling in the toes. The question concerns neurovascular assessment after cast application. Numbness and tingling, paresthesia, in the toes are potential indicators of nerve compression or compromised circulation, possibly due to the cast being too tight or swelling within the cast. This finding suggests compartment syndrome or nerve damage and requires immediate evaluation by the provider. Strong pulses, pink/warm toes, and brisk capillary refill are all signs of good neurovascular status. Think of numbness/tingling as a warning sign that nerves might be pinched. Question 44. A client is diagnosed with bacterial meningitis. Which nursing intervention should be implemented immediately? A. Administer antibiotics intravenously. B. Perform a lumbar puncture. C. Isolate the client in a private room. D. Encourage fluid intake. Answer: C. Isolate the client in a private room. This question addresses precautions for infectious diseases. Bacterial meningitis is contagious and typically spread through respiratory droplets. Therefore, implementing droplet precautions by placing the client in a private room or with another client who has the same infection is the immediate priority to prevent transmission to others. While antibiotics, A, and lumbar puncture, B, are crucial diagnostic and treatment steps, infection control must be initiated first. Encouraging fluids, D, is supportive care. Remember to isolate patients with meningitis quickly to protect others. Question 45. A client is taking isosorbide mononitrate, IMDUR, for angina. What should the nurse teach the client about potential side effects? A. Severe constipation. B. Headache and dizziness. C. Shortness of breath. D. Rash. Answer B. Headache and dizziness. This question focuses on patient teaching for nitrate medications used to treat angina, chest pain. Isosorbide mononitrate is a vasodilator. The primary side effects are related to its blood vessel relaxing effect, leading to headaches due to cerebral vasodilation, and dizziness or orthostatic hypotension, a drop in blood pressure upon standing. Constipation, shortness of breath, and rash are not the characteristic side effects of this medication class. Always sit down when taking nitrate medication for chest pain to avoid falls from dizziness. Question 46. A nurse is assessing a client who underwent coronary artery bypass grafting, CABG, surgery. Which finding is most concerning? A. Chest tube draining 50 ml serosanguinous fluid per hour. B. Pain rated 7 out of 10 at the incision site, managed with 4-morphine. C. Urine output of 20 ml in the last hour. D. Temperature of 98, 9 degree F, 37, 2 degree C. Answer C. Urine output of 20 ml in the last hour. The question tests the recognition of critical postoperative complications after CABG. Adequate urine output, typically greater than 30 ml per hour or 0.5 ml/kg/HR, is a key indicator of effective cardiac output and kidney perfusion. An output of only 20 ml in the last hour suggests potentially inadequate tissue perfusion, possibly due to low cardiac output, hypovolemia, or kidney issues, and requires immediate assessment. While chest tube drainage needs monitoring, 50 ml serosanguinous fluid per hour might be acceptable depending on the time post-op. Significant bloody drainage or greater than 100 ml per hour usually raises concern. Incisional pain and low-grade temp are common. Think of urine output as a direct measure of how well the heart is pumping blood through the body. Question 47. A client is diagnosed with hypothyroidism. Which symptom is most commonly associated with this condition? A. Weight loss and diarrhea. B. Heat intolerance and sweating. C. Fatigue and weight gain. D. Tremors and palpitations. Answer C. Fatigue and weight gain. This question relates to the clinical manifestations of hypothyroidism, a condition where the thyroid gland is underactive and produces insufficient thyroid hormone. Thyroid hormone regulates metabolism, therefore, low levels slow down metabolic processes. This commonly results in symptoms such as fatigue, sluggishness, increased sensitivity to cold, dry skin, constipation, and weight gain, despite possibly decreased appetite. Weight loss, heat intolerance, tremors, and palpitations are typically associated with hyperthyroidism, overactive thyroid E. Remember, low thyroid hormone means a slow metabolism, leading to fatigue and weight gain. Question 48. A nurse is teaching a client about managing osteoarthritis. Which recommendation is most appropriate? A. Rest the affected joints completely. B. Apply heat packs to stiff joints. C. Avoid all weight-bearing exercises. D. Increase intake of dairy products only. Answer B. Apply heat packs to stiff joints. The question focuses on non-pharmacological management of osteoarthritis, a degenerative joint disease. Applying heat, e.g., heat packs, warm compresses, warm baths, can help relieve pain and stiffness in affected joints by increasing blood flow and relaxing muscles. Complete rest, A, can lead to stiffness. Weight-bearing exercises, C, are often beneficial in moderation, like aquatic exercise, and while calcium is important, D, it's not the sole dietary focus, and heat application is key for symptom relief. Think of heat as a warm hug for your aching joints. Question 49. A client is prescribed gentamicin, garamicin, an aminoglycoside antibiotic. What serious adverse effect should the nurse monitor for? A, ototoxicity, hearing damage. B, photosensitivity. C, gingival hyperplasia. D, respiratory depression. Answer: A, ototoxicity, hearing damage. This question relates to the potential toxic effects of specific antibiotic classes. Aminoglycosides like gentamicin are known for their potential nephrotoxicity, kidney damage, and ototoxicity, damage to the inner ear, potentially causing hearing loss or balance problems. Monitoring for tinnitus, ringing in the ears, or hearing changes is crucial. Photosensitivity is associated with tetracyclines, gingival hyperplasia with phenytoin, and respiratory depression with opioids or sedatives. Remember, gentle hearing is important when taking gentamicin. Question 50. A client is admitted with cellulitis of the lower leg. What is the most appropriate nursing action? A, apply cold compresses to the affected area. B, administer prescribed antibiotics and elevate the leg. C, encourage ambulation to improve circulation. D, restrict fluid intake. Answer: B, administer prescribed antibiotics and elevate the leg. This question addresses the management of cellulitis, a bacterial skin infection. The priority treatments are administering antibiotics to fight the infection and elevating the affected limb. Elevation helps reduce swelling, edema, and promotes venous return, aiding the healing process and reducing discomfort. Cold compresses, A, might provide temporary relief but aren't the primary treatment. Heat is often preferred for inflammation. Ambulation, C, might be painful and could worsen swelling initially, and fluid restriction, D, is inappropriate as adequate hydration is needed for healing and fighting infection. Think of treating infection and reducing swelling as the two main goals for cellulitis. Question 51. A nurse is preparing to administer an initial dose of an antihypertensive medication. What is the most important assessment immediately following administration? A, client's weight. B, client's temperature. C, client's blood pressure. D, client's respiratory rate. Answer: C, client's blood pressure. The question focuses on the immediate effects of starting an antihypertensive medication. These drugs work by lowering blood pressure, and the most critical potential adverse effect, especially with the first dose, is excessive hypotension, dangerously low blood pressure, which can lead to dizziness, falls, or reduce blood flow to vital organs. Therefore, monitoring the blood pressure shortly after administration is essential to assess the drug's effect and the client's response. Weight, temperature, and respiratory rate are important assessments but not the highest priority immediately following the first dose of this specific medication type. Always check blood pressure after giving a blood pressure pill for the first time. Question 52. A client with a history of pancreatitis is advised to avoid which substance? A, water. B, alcohol. C, clear liquids. D, low-fat crackers. Answer: B, alcohol. This question relates to dietary management for pancreatitis, inflammation of the pancreas. Alcohol consumption is a major cause and exacerbating factor for pancreatitis, as it directly irritates the pancreas and stimulates digestive secretions. Avoiding alcohol is paramount for recovery and preventing future episodes. Water and clear liquids are generally encouraged, and low-fat foods are recommended. Think of alcohol as poison to an inflamed pancreas. Question 53. A client is receiving warfarin, Coumadin. The nurse teaches the client to avoid which herbal supplement due to potential interaction? A. Garlic. B. Ginger. C. Ginseng. D. All of the above. Answer, D. All of the above. The question pertains to drug-herb interactions, specifically with warfarin. Many herbs, including garlic, ginger, and ginseng, have natural anticoagulant or antiplatelet properties. Combining these herbs with warfarin can potentiate its effect, significantly increasing the risk of bleeding. It's crucial for clients on warfarin to consult their provider before taking any herbal supplements. Remember, many herbs can increase bleeding risk, especially with blood thinners. Question 54. A nurse is assessing a client who reports dizziness and palpitations. The client has a history of atrial fibrillation. What finding requires the most urgent intervention? A. Pulse rate of 70 beats per minute. B. Blood pressure of 110/70 mmHg. C. Pulse deficit of 20 beats per minute. D. Blood pressure of 85/50 mmHg. Answer, D. Blood pressure of 85/50 mmHg. The question involves assessing a client with a known cardiac condition, atrial fibrillation, reporting concerning symptoms. Dizziness and palpitations can occur with atrial fibrillation, but hypotension, low blood pressure, is a critical sign of inadequate cardiac output or potential shock. A blood pressure of 85/50 mm of mercury is significantly low and requires immediate intervention to improve perfusion. While a pulse deficit, C, indicates potential issues, like poor ventricular contraction, the severely low BP is the most immediately life-threatening finding. A pulse rate of 70, A, and BP of 110/70, B, are within acceptable ranges. Think of critically low blood pressure as the most urgent alarm. Question 55. A client is prescribed nitroglycerin, nitrostat, tablets for angina. What is the correct way to use this medication? A. Swallow the tablet whole with water as soon as chest pain starts. B. Place the tablet under the tongue and let it dissolve when chest pain occurs. C. Crush the tablet and mix it with applesauce if swallowing is difficult. D. Take one tablet every 8 hours routinely to prevent chest pain. Answer, B. Place the tablet under the tongue and let it dissolve when chest pain occurs. This question assesses the correct administration of sublingual nitroglycerin for angina relief. The sublingual route allows the medication to be absorbed directly into the bloodstream through the oral mucosa, providing rapid relief of chest pain. It should be taken as soon as chest pain begins. Swallowing, A, makes it a longer-acting oral form. Crushing, C, is inappropriate for sublingual tablets, and routine fixed dosing, D, is usually done with longer-acting forms, not rescue tablets. Remember, under the tongue means fast relief for chest pain. Question 56. A client is receiving a continuous infusion of heparin for deep vein thrombosis, DVT. What laboratory value should the nurse monitor to assess the medication's effectiveness? A. Prothrombin time, PT. B. Activated partial thromboplastin time, APTT. C. Platelet count. D. International Normalized Ratio, INR. Answer, B. Activated partial thromboplastin time, APTT. The question relates to monitoring anticoagulant therapy. Heparin works by activating antithrombin 3, which inhibits factors 9, X, and thrombin. Its effect is best monitored by the APTT, which measures the time it takes for blood to clot via the intrinsic pathway, significantly influenced by heparin. PT and INR, A, D, are used to monitor warfarin, Coumadin. While a platelet count, C, is important to monitor for HIT, heparin-induced thrombocytopenia, the APTT directly measures heparin's therapeutic effect. Think of APTT as the lab test that tracks how well heparin is working. Question 57. A nurse is providing discharge teaching for a client who had a knee arthroscopy. Which instruction is crucial? A. Apply heat packs to the knee continuously. B. Maintain strict non-weight bearing on the affected leg. C. Elevate the leg and apply ice packs as needed. D. Avoid all range of motion exercises. Answer, C. Elevate the leg and apply ice packs as needed. This question focuses on post-procedure care for knee arthroscopy. The standard post-operative instructions include RICE: rest, ice, compression, and elevation. Elevating the leg helps reduce swelling, and applying ice packs, intermittently, helps decrease pain and inflammation. Applying heat continuously, A, is generally not recommended initially as it can increase swelling. Non-weight bearing, B, instructions vary depending on the procedure done inside the knee, but often some weight bearing is allowed. Avoiding all range of motion, D, would lead to stiffness. Exercises are usually encouraged. Remember RICE: rest, ice, compression, elevation after knee surgery. Question 58. A client has a new prescription for sertraline, Zoloft, an SSRI antidepressant. Which potential side effect requires immediate nursing follow-up? A. Mild nausea. B. Insomnia. C. Increased suicidal thoughts. D. Dry mouth. Answer, C. Increased suicidal thoughts. This question addresses patient safety concerning antidepressant medications, specifically selective serotonin reuptake inhibitors, SSRIs, like sertraline. While side effects like nausea, insomnia, and dry mouth are common and usually manageable, a potential risk, especially early in treatment or when doses are changed, is an increase in suicidal ideation or behavior, particularly in younger adults. This requires immediate follow-up with the healthcare provider to assess the risk and potentially adjust the medication or treatment plan. Think of this warning sign as needing immediate attention, like a critical alert. Question 59. A nurse is assessing a client with pancreatitis. Which finding is characteristic of chronic pancreatitis? A. Severe, sudden onset abdominal pain. B. Steatorrhea, fatty stools. C. Rebound tenderness. D. Fever and elevated white blood cell count. Answer, B. Steatorrhea, fatty stools. The question distinguishes between acute and chronic pancreatitis symptoms. Acute pancreatitis typically presents with severe, sudden abdominal pain, A, and may involve fever/elevated WBCs, D, and rebound tenderness, C, if severe. Chronic pancreatitis, however, results from progressive damage to the pancreas, leading to impaired enzyme production. This often manifests as malabsorption, characterized by steatorrhea, fatty, floating, foul-smelling stools due to undigested fat. Remember, chronic pancreatitis often means poor digestion leading to fatty stools. Question 60. A client is scheduled for a colonoscopy. Which instruction should the nurse provide regarding dietary preparation? A. Eat a high-fiber diet for 3 days prior. B. Consume only clear liquids the day before the procedure. C. Drink plenty of milk the day before. D. Eat a regular diet until the morning of the procedure. Answer B. Consume only clear liquids the day before the procedure. This question pertains to bowel preparation for a colonoscopy. A clear liquid diet is essential the day before the procedure to ensure the colon is empty and free of stool, allowing for clear visualization of the lining. High-fiber diets, A, or regular diets, D, would leave residual stool. Milk, C, is often excluded even from clear liquid diets as it can be poorly digested and leave residue. Think of clear liquids as washing the colon clean for the procedure. Question 61. A client with schizophrenia is taking clozapine, Clozaril. What is the most critical safety monitoring required for this medication? A. Blood glucose levels. B. Liver function tests. C. Absolute neutrophil count, ANC. D. Potassium levels. Answer C. Absolute neutrophil count, ANC. The question relates to the serious adverse effects associated with clozapine, an atypical antipsychotic. Clozapine carries a risk of causing agranulocytosis, a potentially fatal condition where the white blood cell count, specifically neutrophils, a type of infection-fighting white blood cell, drops dangerously low. This makes the client highly susceptible to infection. Therefore, strict monitoring of the ANC through regular blood tests is mandatory before, during, and after treatment with clozapine. While monitoring glucose, A, and liver function, B, is also important for clozapine, the risk of agranulocytosis makes ANC monitoring the highest priority. Potassium levels, D, are not the primary concern. Remember, clozapine requires strict blood monitoring for infection risk. Question 62. A client has just had a sentinel lymph node biopsy, SLNB, as part of breast cancer treatment. What is the priority post-procedure nursing assessment? A. Assess the biopsy site for bleeding and infection. B. Encourage vigorous arm exercises. C. Administer opioid pain medication routinely. D. Check for signs of lymphedema immediately. Answer A. Assess the biopsy site for bleeding and infection. The question focuses on postoperative care following a minimally invasive surgical procedure like SLNB. The priority is to monitor the direct site of the biopsy for immediate complications like bleeding or signs of infection, redness, warmth, increased pain, drainage. While pain management, C, is important, it's not necessarily routine opioids unless pain is significant. Arm exercises, B, are usually introduced gradually, and lymphedema, D, is a longer-term potential complication, not typically assessed immediately after the biopsy itself. Remember to check the wound site first after any procedure. Question 63. A client is prescribed metformin, glucophage, for type 2 diabetes. Which instruction is most important regarding potential side effects? A. Monitor for excessive thirst and urination. B. Report any muscle cramps immediately. C. Avoid alcohol consumption completely. D. Take the medication with a high-fat meal. Answer C. Avoid alcohol consumption completely. This question addresses key patient teaching for metformin, a common first-line medication for type 2 diabetes. While metformin rarely causes hypoglycemia, it can increase the risk of lactic acidosis, a rare but serious metabolic complication, especially when combined with alcohol. Alcohol consumption inhibits lactate metabolism and can potentiate this risk. Excessive thirst/urination, A, relates more to uncontrolled diabetes itself. Muscle cramps, B, can occur but aren't usually the primary safety concern requiring immediate cessation. Metformin is typically taken with meals to improve tolerance and absorption, but a high-fat meal isn't specifically required or advised over other meals. Avoiding alcohol is the most critical safety advice. Think of avoiding alcohol while on metformin to prevent a rare but serious condition. Question 64. A client is recovering from surgery and has a Foley catheter. Which finding requires immediate nursing assessment? A. Catheter drainage is pale yellow and clear. B. Client reports feeling the urge to urinate. C. No urine output for the past 4 hours. D. The catheter is taped securely to the client's thigh. Answer, C. No urine output for the past 4 hours. The question focuses on monitoring output for a client with a Foley catheter. A lack of urine output for several hours, typically considered 8 to 12 hours, but 4 hours warrants assessment, can indicate several serious problems, such as obstruction of the catheter, severe dehydration, kidney injury, or decreased kidney perfusion. It requires immediate investigation. Pale yellow, clear urine, A, is normal. The urge to urinate, B, can happen even with a catheter due to bladder irritation, and securing the catheter, D, is correct technique but not an urgent problem indicator. Always check why the catheter isn't draining. Question 65. A client is taking atorvastatin, Lipitor. What essential teaching should the nurse provide regarding potential side effects? A. Report any muscle aches or weakness immediately. B. Take this medication on an empty stomach for best absorption. C. Avoid consuming dairy products while taking this medication. D. This medication is primarily used to lower blood pressure. Answer. A. Report any muscle aches or weakness immediately. This question tests knowledge of statins, commonly used to lower cholesterol. Atorvastatin belongs to this class, and a significant potential side effect is rhabdomyolysis, a severe form of muscle breakdown. Muscle aches or weakness are early warning signs that must be reported immediately to the healthcare provider, as this could indicate progressing muscle damage. Statins are generally well absorbed with or without food. Dairy products are not typically contraindicated, and their primary use is cholesterol reduction, not blood pressure control. Always listen to your body for muscle pain when taking statins. Question 66. A client is admitted with symptoms suggestive of a stroke. Which assessment finding indicates a potential problem with the cerebellum? A. Expressive aphasia. B. Difficulty swallowing. C. Poor coordination and balance. D. Left-sided weakness. Answer, C. Poor coordination and balance. The question relates to neurological assessment and localization of deficits. The cerebellum is primarily responsible for coordinating voluntary movements, posture, and balance. Therefore, cerebellar dysfunction often manifests as ataxia, lack of voluntary coordination, problems with balance, gait disturbances, and intention tremors. Expressive aphasia, A, relates to the frontal lobe, Broca's area. Difficulty swallowing, B, often involves cranial nerves or the brainstem, and left-sided weakness, D, typically indicates a problem in the right side of the cerebrum or the corticospinal tract. Think of the cerebellum as the body's coordinator. If it's off, movements become clumsy. Question 67. A client is prescribed lisinopril, Zestrol, an ACE inhibitor? Which statement by the client indicates a need for further teaching? A. I should report a persistent dry cough. B. I need to change positions slowly to avoid dizziness. C. This medication helps relax my blood vessels. D. I can take this medication with a potassium supplement. Answer: D. I can take this medication with a potassium supplement. The question addresses ACE inhibitors and their effects/interactions. Lisinopril can cause the body to retain potassium, potentially leading to hyperkalemia, high potassium levels. Therefore, clients taking ACE inhibitors are often advised to avoid potassium supplements or salt substitutes, which often contain potassium chloride, unless specifically directed by their provider. Reporting a cough, A. Changing positions slowly due to potential orthostatic hypotension, B. And understanding that it relaxes blood vessels, C. Are all correct understandings. Remember, ACE inhibitors can make potassium levels rise, so be cautious with potassium supplements. Question 68. A nurse is caring for a client receiving a blood transfusion. The client suddenly complains of chills and itching. What is the priority nursing action? A. Administer an antihistamine immediately. B. Slow the transfusion rate and notify the provider. C. Increase the rate to finish the transfusion quickly. D. Apply warm blankets to the client. Answer: B. Slow the transfusion rate and notify the provider. The question relates to recognizing and responding to a potential transfusion reaction. Chills and itching are early signs of a possible reaction, such as an allergic reaction. The priority is to stop the transfusion immediately to prevent the reaction from worsening and notify the healthcare provider for further orders. Administering an antihistamine, A, might be ordered, but stopping the blood first is crucial. Increasing the rate, C, or applying warm blankets, D, would be inappropriate and potentially dangerous. Always stop the blood first if you suspect a reaction. Question 69. A client with asthma has a prescription for fluticasone, Flovent, an inhaled corticosteroid. What should the nurse teach the client about using this medication? A. Use it as needed for quick relief of symptoms. B. Rinse the mouth with water after each use. C. Increase the dose if symptoms worsen significantly. D. Expect immediate relief of wheezing. Answer: B. Rinse the mouth with water after each use. This question focuses on the proper use of inhaled corticosteroids, ICS, for asthma control. ICS help reduce airway inflammation but are not rescue medications for acute symptoms. A crucial instruction is to rinse the mouth with water after using the inhaler to prevent oral candidiasis, thrush, and reduce systemic absorption. Fluticasone is a controller medication, not for quick relief, A, and dose increases should be guided by a provider, C. Immediate relief is characteristic of bronchodilators, not ICS, D. Remember to rinse your mouth after using steroid inhalers to prevent thrush. Question 70. A client is diagnosed with pernicious anemia. The nurse knows this condition is caused by a deficiency of A. Iron. B. Vitamin K. C. Intrinsic factor. D. Folic acid. Answer: C. Intrinsic factor. The question asks for the cause of pernicious anemia. Pernicious anemia is a type of macrocytic anemia resulting from a deficiency in vitamin B12 absorption. The underlying cause is the lack of intrinsic factor, a substance produced by the stomach lining, which is necessary for the small intestine to absorb vitamin B12. Therefore, even if the diet contains adequate B12, without intrinsic factor, it cannot be absorbed. Iron deficiency causes iron deficiency anemia, vitamin K is for clotting, and folic acid deficiency causes a different type of macrocytic anemia. Think of intrinsic factor as the key needed to unlock vitamin B12 absorption. Question 71. A client is experiencing chest pain and is prescribed sublingual nitroglycerin. After administering one dose, the client states the pain has not subsided. What should the nurse do next? A. Administer a second sublingual nitroglycerin tablet. B. Administer morphine sulfate intravenously. C. Assess the client's vital signs and lung sounds. D. Document the client's report of pain. Answer. A. Administer a second sublingual nitroglycerin tablet. This question deals with the protocol for managing angina unresponsive to the initial dose of sublingual nitroglycerin. Standard practice allows for reassessment and administration of a second dose after about 5 minutes if pain persists. If pain remains after a total of 3 doses, taken 5 minutes apart, or if other concerning symptoms arise, then further intervention like assessing vitals/lung sounds, C, or administering morphine, B, would be considered. Simply documenting, D, or moving to other interventions without completing the nitroglycerin protocol is incorrect. Follow the 5-minute, 3-dose rule for chest pain relief with nitro. Question 72. A nurse is evaluating the effectiveness of fall prevention strategies for an elderly client in a healthcare facility. Which observation indicates the strategies are effective? A. The client ambulates independently in the hallway without assistance. B. The client's bed alarm is frequently activated. C. The client wears only socks while walking in their room. D. The client keeps the call light within reach at all times. Answer, D. The client keeps the call light within reach at all times. This question assesses the effectiveness of fall prevention measures. Keeping the call light within easy reach is a fundamental strategy that empowers the client to request assistance when needed, reducing the likelihood of them attempting to ambulate unsafely. Independent ambulation without support, A, might be risky if the client has mobility issues. Frequent bed alarms, B, might indicate the client is attempting to get up unsafely, suggesting interventions aren't fully effective. Wearing only socks, C, increases the risk of slipping. Ensuring the call light is accessible empowers the client and is a key component of safe ambulation assistance. Think of the call light as the client's direct line for safe help. Question 73. A client with chronic kidney disease, CKD, is on hemodialysis. Which dietary restriction is typically most important? A. Low protein. B. Low potassium. C. Low carbohydrate. D. Low fat. Answer, B. Low potassium. The question addresses dietary management for CKD patients on hemodialysis. Damaged kidneys are unable to effectively remove potassium from the blood, leading to a risk of hyperkalemia, high potassium. Therefore, restricting potassium-rich foods like bananas, oranges, potatoes, and tomatoes is crucial. Protein intake is often managed, sometimes restricted, sometimes increased depending on dialysis status, but potassium is usually the primary electrolyte focus. Carbohydrate and fat restrictions aren't typically the main focus unless comorbidities like diabetes or cardiovascular disease exist. Remember, dialysis patients need to watch their potassium intake carefully. Question 74. A nurse is caring for a client recovering from a stroke. Which assessment finding suggests increased intracranial pressure, ICP? A. blood pressure 100/60 mmHg. B. Heart rate 110 beats/min. C. Pupil response sluggish to light. D. Temperature 98, 6 degree F, 37, 0 degree C. Answer, C. Pupil response sluggish to light. The question relates to recognizing signs of increased intracranial pressure, ICP, following a stroke. Increased ICP puts pressure on the brainstem, affecting cranial nerve function. Sluggish or unequal pupil response to light is a late and serious sign indicating potential brainstem compression. While a rising systolic blood pressure and a slowing pulse, Cushing's triad, also indicate increased ICP, sluggish pupils are a direct neurological sign requiring immediate attention. The other options, low BP, high heart rate, normal temp, are less specific or indicative of increased ICP. Think of pupil changes as a sign the brain is under pressure. Question 75. A client is receiving warfarin, Coumadin. Which finding would indicate the medication is therapeutic? A. INR of 0, 9. B. INR of 1, 5. C. INR of 2, 5. D. PT of 11 seconds. Answer, C. INR of 2, 5. The question assesses understanding of therapeutic monitoring for warfarin. The International Normalized Ratio, INR, is used to standardize the measurement of clotting time for clients on warfarin. The therapeutic range is typically 2, 0 to 3, 0 for most indications like DVT or atrial fibrillation, meaning the blood is adequately thinned. An INR of 0, 9 or 1, 5, A, B, is subtherapeutic, not enough effect, and a normal PT of 11 seconds, D, doesn't reflect the warfarin effect, which is measured by INR. An INR of 2, 5 falls within the desired therapeutic range. Remember, the goal for warfarin is an INR between 2 and 3.